Hello and welcome to the CPAP setup video. We are sleep physiologists at New Cross and Cannock Hospital. Previously you had a sleep study which confirmed a diagnosis of obstructive sleep apnea. This is where your airways close temporarily multiple times throughout the night. Less than 5 times an hour is classed as normal, 5 to 15 times an hour mild, 16 to 30 moderate, and over 30 times an hour severe. Due to this, your sleep is disturbed, which can leave you feeling tired. The main treatment for sleep apnea is a device called CPAP, which stands for Continuous Positive Airway Pressure. This works to blow a pressure of air into your airways via a mask that you must wear to bed while you sleep. This prevents your airways from closing.
It may take some time for you to get comfortable using your CPAP machine, but this is normal during the first few nights. You'll find that you're waking up more times than normal, but this is just because your body's getting used to using the machine. In this video, we will talk you through the components of the CPAP machine, how to set up and utilise the CPAP machine, how to maintain the equipment, and also the follow-up process.
You will have been given your ResMed AirSense 10 CPAP machine in this travel bag. There are different sections for the various components of your device. There is the ResMed CPAP machine. Next to it is the humidifier chamber. Located in the back section, you will find the tubing. At the front, there is a power supply unit, your CPAP mask and spare filters. Finally, in the top pockets, there are additional leaflets and information about your CPAP machine. One of the leaflets you may find beneficial is a departmental handbook, which has all the information in this video written down.
Your CPAP machine should be placed on a level surface at your bedside, such as on a bedside cabinet, preferably lower than your head. The CPAP needs to be plugged into the mains electricity. The other end of the power supply unit fits into the back of the machine. When you switch the machine on using the main switch, a few messages will appear. After a few seconds, these will disappear and the main screen is displayed. To start the machine blowing, press the power button located at the top of the machine. The machine will then build to a pressure of 4 centimetres of water and then go dark to allow you to sleep. This is the lowest pressure the machine can blow and feels similar to a gentle breeze from a fan. Whilst you're awake, the pressure will remain at this low pressure. When you're asleep and your airways begin to close, the machine will detect this and change its pressure in order to keep your airways open. Therefore, your machine adjusts its pressure throughout the night, sometimes blown harder and sometimes gentler. Hopefully you shouldn't be aware of this and you'll be asleep. To stop the machine from blowing, use the same power button at the top of the machine. At the end of every use, the machine likes to give you feedback. At the top of the machine, it will tell you how long you have used this for. Ideally, we would like you to use this all night, every night. As previously discussed, it may take you a few days to get your usage to all night. This is normal. The only times we suggest not to use your CPAP is if you feel sick or feel you have a chest infection. Once you feel better, you should resume using your CPAP machine. This is a treatment and you will therefore only be treated when you use the device. At the bottom, it shows your mask fit in a series of faces. This is for your information. A happy face means your mask fit correctly throughout the night. If you receive a red face, you need to assess your mask fit. Have you adjusted it correctly? Have you washed it accordingly to our guidance? Did you knock it during the night? If your mask leak has started to affect your treatment, we will notice and contact you. If your mask leaks during the night, the machine will increase its pressure to compensate for the air being lost. This may become noisy and wake you. In this situation, it is best you stop your machine from blowing and adjust your mask and restart the treatment. To get back to the home page after receiving feedback, press the home button. Your machine is essentially like a compressor and therefore uses room air. This air passes through a filter located at the side of the machine. Use the catch at the back of the machine to access the filter. Every few days you should take the filter out and flick it to remove the dust. Every 6 months, or if the filter appears dirty, replace it with a new one. Spare filters have been provided. A tube is used to connect the machine and the mask together. The tube has identical ends. One end should be pushed onto the elbow piece at the back of the machine, and the other will attach to the mask. The tube is long to allow movement. However, some patients prefer to have their tube run over the back of the headboard for comfort. You do not have to do this. Your tube should be cleaned on a weekly basis, pass warm soapy water through and rinse out, allowing to air dry.
One of the main side effects from your CPAP is a dry mouth. To overcome this, we will provide you with a humidifier. To use this, you need to remove the end plate from the CPAP machine. There is a small catch on the right hand side of your CPAP. Using your finger and thumb, press down this catch and slide the end plate out. This will be replaced with a humidifier chamber. At the side of the chamber there is a catch. Lift this and open the lid. To get moisture, this chamber must be filled with water to the maximum line. You may use tap water for this. If this is the case, boil in a kettle first and allow to cool before putting into the chamber. Some patients use bottled or filtered water as an alternative. This must be fresh water every night and the chamber must be cleaned every day using warm soapy water. Once filled, close the lid gently and slide the humidifier chamber inside the CPAP machine until it is flush. To remove the chamber, using your finger and thumb, press down the grey catch on top of the humidifier and slide it out. As this is a comfort setting, you're able to adjust this. To do so, use the silver dial and click the dial into Select My Options. Use the dial to scroll down to Humidity settings and click the dial to select. Using the dial, you can alter the humidifier setting, depending on if you're suffering with a dry mouth. If you do, then increase the humidity by selecting a higher number. If you experience water in the tube or mask, then reduce the humidifier by selecting a lower number. To confirm your humidity, push the silver dial to store your settings and press the home button to get back to the main screen. Your humidifier setting does not change the pressure of your machine and therefore you can adjust this as much as you should need.
Your mask will cover both your nose and your mouth, so you do not need to worry which one you breathe through. Remove the mask from the clear plastic bag. Unclip the additional plastic strip from the frame of the mask and remove the mask connector. Press the connector into the mask until you hear a click. Your mask will come in three main parts. The first part is the headgear, which attaches the mask to the face. It has Velcro straps. These can be adjusted to ensure a good mask fit. The second component is the plastic outer shell. The elbow at the front of the mask is where the tube pushes on. The elbow has two clips, which can be used to disconnect and reconnect the tube. Most people use this if they go to the bathroom in the night. Turn the machine off, press the clips and disconnect from the frame. The cushion is the final and most important component of the mask, as this ensures the mask is sealed against the face and allows the treatment pressure to be delivered. Having the mask too loose will result in air leaking from the mask. However, over-tightening the mask will affect the seal and similarly cause air to escape. You must also keep the cushion clean, as oils from the skin can sit on the cushion and interfere with mask leak. To clean the mask, squeeze the bottom of the cushion and it should disconnect from the frame. This should be cleaned daily with warm soapy water. No chemicals should be used, as this may react with your skin. It can then be left to air dry. The headgear can also be washed fortnightly. Remove the magnetic clips and plastic frame and the headgear is safe to wash in the washing machine. As you are new to the CPAP machine, it may be easier to fit your mask in a mirror or with the help of a relative or friend to begin with. To do so, remove the two magnetic clips attached to the frame and bring the headgear forward. Place the mask cushion on the bridge of the nose and roll the cushion onto the face so the bottom of the mask fits below the bottom lip but above the chin. Pull the headgear over the back of your head and attach the magnetic clips to the frame. On each side, use the Velcro strips to adjust the mask fit. Once set in place, you will only need to use the magnetic clips to take the mask on and off. Finally, you need to attach the other end of the tube onto the elbow of the mask. To remove the mask, remove the magnetic clips attached to the frame at the front, grab the headgear at the back and pull forwards to slide the mask off your face. Routine appointments are crucial in enabling our patients to get the maximum benefits from the CPAP machine. To do this, the data from your CPAP machine is sent automatically to the sleep service so we can monitor it using a system called remote monitoring. You can also access your data via myAir website. Please see the leaflet located in your CPAP travel bag. You will also receive a yearly review where new consumables are issued to aid your usage. If you need new consumables before this time, please email us on the email address below. If you do have any problems or questions, you can contact the sleep department on 01902 69 5061. This number can also be found on the back of the departmental handbook.
Initially, CPAP may be daunting for some people and the first few nights might be difficult, but please persevere and with time you may feel the maximum benefits and start feeling positive about the treatment. To achieve the maximum benefit, do try and use your CPAP machine all night and remember perseverance is key, and good luck. Thank you.